Last week marked 1 year since a Lawrenceburg man died while in custody at the Franklin County Regional Jail. Dylan Stratton spent nearly 6 days behind bars struggling through detox. As we reported last fall, his mother suing the jail, county leaders, and the medical company for wrongful death, claiming her son was suffering from a drug withdrawal and died because he didn't get emergency medical care. Days before our story aired, the jailer retired and a new jailer was hired. Both the jail and medical company deny any responsibility in Stratton's death. LEX18's Elise Searcy recently sat down with the new Franklin County jailer to see if anything has changed. That's the focus of this LEX18 Investigates.
When Dylan Stratton was arrested last year, it was his first and last trip to the Franklin County Regional Jail. The jail's own cameras captured his nearly 6 days here, day by day, hour by hour. His mother, Leslie Glass, claims he had a seizure, then slowly detoxed to death due to no emergency medical care.
Why? That's the question that I keep asking. Why? Why wouldn't anyone help him?
Mr. Stratton, are you going to hire an attorney to represent you?
A judge who arraigned Stratton just days earlier in person had this reaction when she saw him over video later, sitting in a chair, unable to speak.
Is this a detoxing situation? What is going on?
Yes, Your Honor.
Have they been medically treated?
Yes, Your Honor.
Less than 24 hours later, Stratton was found dead on the concrete floor of his cell. The coroner ruled his cause of death cardiac dysrhythmia and noted obesity and chronic drug use.
If you'd taken him to the hospital, he would not have died.
Days after our story first aired, attorneys for the jailer and his deputies filed paperwork asking a judge to dismiss the case, claiming the lawsuit fails to identify specific actions taken by any particular staff member that contributed to Stratton's death. In it, they wrote the staff kept logs on his health, showing he was showered, showed signs of vomiting and diarrhea, received water, and skipped some meals. They say a deputy jailer also contacted the jail's medical provider, who recommended he remain under observation and be put in a safety chair as needed. 1 year later, attorneys suing for wrongful death on behalf of Stratton's family say he should have been sent to a hospital instead. They want to know what the jail and Southern Health Partners, the company hired to medically treat inmates, are doing differently.
You've got a young man who is naked in a cell. He's talking to people that aren't there. He is suffering. It's obvious. You do something, and nobody did anything.
According to the family's lawsuit, a nurse practitioner was at the facility seeing patients the day before Stratton died, but never saw him. The suit claims other jail nurses did not put him on a list to be seen by the nurse practitioner.
Southern Health Partners has policies and procedures that should have prevented what happened.
We've been asking questions since our first story last fall. We repeatedly, in person and over the phone, attempted to talk to former jailer Rick Rogers, who never responded to our requests, then retired in early September.
We've made a few changes since I've came in, nothing drastic.
Rogers' appointed successor, Jake BANTA, did sit down with us, but said he cannot speak about what happened to Dylan Stratton due to pending litigation. He did talk about treating everyone from staff to inmates equally.
My philosophy is people make bad decisions sometimes. That doesn't make them a bad person. I've always believed that. I believe in the justice system, but I also believe that these people in here are human beings, and we're going to be firm, fair, and consistent.
We've learned before BANTA took over, the jail in Franklin County Fiscal Court renewed its contract with Southern Health Partners, a Chattanooga-based company that serves approximately 30 jails here in Kentucky. The same company, Glass alleges in the suit, fabricated Stratton's observation records. She claims the day Stratton died, a nurse turned over only 2 columns of his chart. Then more than a month later, says Southern Health Partners, submitted 2 pages of entries that she believes were fabricated.
He was unable to talk. He was in psychosis.
The lawsuit says there were no entries showing any deterioration in Dylan's condition, despite his obviously emergent psychotic condition and the progressive decline of his physical, mental, and emotional state, as recognized by Judge Mangent less than 24 hours before he died. Here's a copy of his withdrawal chart 2 days before his death that showed no circled for signs of weakness, confusion, and slurred speech. Leslie Glass wants to know why her son didn't get more medical help even after the judge asked about it.
Are you all going to be able to transport Mr. Stratton?
Probably not, Your Honor.
Glass says Southern Health Partners didn't follow its own policies that state on the company's own withdrawal form it requires staff to report all findings to the medical director, especially if patient is not responding well. It goes on to state if patient experiences changes or deterioration is noted, to notify physician immediately.
They should be ashamed of themselves. I mean, what kind of medical establishment are you?
We once again reached out to Southern Health Partners to get an explanation. No one returned our calls. Last fall, an attorney referred us to the company's response to the lawsuit, which claims its staff acted in good faith and that if Dylan Stratton suffered any harm, it was a result of his own actions, not those of SHP. We asked new Franklin County jailer Jake BANTA about Southern Health Partners' new contract. He says the former jailer had already negotiated more medical care at the jail before he took over.
On a large percentage of the scale, we're 24 hours a day medical, around the clock medical, and that's helped with incoming people. The medical staff being around the clock is already paid off. There's several incidents where it's already paid off. I can't really get into it with you, but it's paid off.
Overdoses or illnesses?
It's paid off, is all I'm gonna really say about that, because there's just some things I don't want to discuss about that.
We asked him if he's a jailer who will do all the checks and balances to hold his employees and the medical staff accountable to keep everyone safe.
As much as possible. I've been to the jailer now for 4 months. I'm not perfect and I'm still learning. But yes, we keep checks and balances on everybody that comes through the door as much as possible. But I want to do the right thing morally and ethically for everybody. If somebody needs medical treatment, we're going to get them medical treatment. The best of my ability.
Dylan Stratton's mother hopes so.
I don't know how so many people could walk by my son and no one wanted to help him.
And that was Lee Searcy reporting. Stratton's family is now waiting to see if a judge moves forward with the lawsuit or dismisses it. The new jailer, Jake BANTA, says he is respectfully trying to, quote, move forward to make the jail better for inmates and staff. He says he has changed some training practices, added educational incentives, and stays in close contact with medical staff. LEX18 will stay on top of this case to see what happens next. You can log on to LEX18.com to read more of the legal paperwork from all sides.